The growing number of Zika cases in the U.S. is causing some local families to put off having children. The Centers for Disease Control projects that infected mosquitoes could make their way into Southwest Virginia this summer. WSLS's Christina Craig spoke to a doctor and learned this is a real concern among women in our area wanting to get pregnant.
You want a baby brother?
Joanna Himes, a mother of a 2-year-old, says having children is one of the greatest joys in life. She wants another, but is putting pregnancy on hold due to the increasing number of Zika cases in the U.S.
It's scary enough to be a mom. There's so many factors, things that can go wrong. So for that to be another thing to put into play, just kind of terrifying.
Allison DeRica, a maternal fetal medicine doctor at Carilion Clinic, says Himes' concern is valid. As it gets hotter during the summer months, there's an increased chance that mosquitoes carrying the Zika virus can come into our area.
Greater risk is certainly going to be in the southern areas of the United States and along the coast, but we are close enough to that area that we do fall within that.
The CDC states the virus is found in 40 states, and the Virginia Department of Health reports there's 25 cases in the Commonwealth.
These are not patients that have been directly bitten by an infected mosquito and become infected that way. These are people who have come from an endemic area, an area of high exposure.
DeRica says other mothers have voiced the same concern.
I do have a lot of pregnant friends, so it is a concern for all of us.
Recent CDC guidelines say women that travel to high exposure areas have increased risk of contracting the virus and should try to prevent pregnancy for 8 weeks to minimize risk. Same goes for a man, but men who are actually diagnosed with Zika should wait at least 6 months after their symptoms first appeared to have unprotected sex. In Roanoke, Christina Craig, WSLS 10.